welcome to Indy Talks, brought to you by the Hudson Independent, the most trusted source of local news in the river towns. Our guest this morning is Dr. Nitin Gupta. Dr. Gupta is a pediatrician based in Dobbs Ferry. He has an unusual story to tell, though. He's not your traditional pediatrician, at least in this day and age. Dr. Gupta is originally from California. He was educated, his undergraduate work was done at Berkeley. He did his medical school training initially at St. George's University in Grenada, the island of Grenada. Some of you may remember historically that the United States Marines back in the 1980s invaded Grenada on the pretext that they were going to liberate the students of St. George's University from Cubans and the autocratic government that seemed to be taking root there. But Dr. Gupta was not there when the Marines invaded. He had his training there years later. He is also a certified pediatric gastroenterologist, correct?
No, I've trained in.
Trained in gastroenterology. And he's done the traditional practice as a regular pediatrician. He's worked in emergency rooms, he's worked in a urgent care facility, and he's done traditional kind of practices. But tell us about what you're doing now, and we'll talk a little bit about why.
Yeah. Well, what I'm doing now is what we'd call a concierge, pediatrics now. But basically, it's really to support the parents and to provide more time for these office visits. House calls, 24/7 access, either via telephone, text, video, chat, and really to provide full range of just support for the families.
But what is it that allows you to do this, and what motivated you to break away from the traditional practice? Do you take insurance, for example?
I don't take insurance.
You don't take insurance.
The reason for that is because over the last few years, as insurance companies have been kind of reducing their rates, reimbursement rates to the physicians, what we've been forced to do is see more patients.
Right.
Double booking, triple booking, just piling on the number of patients. That's been lowering the interaction between the doctor and the patient. To now the national average is about 7 minutes.
7 minutes per patient,
which is really unsustainable. And especially if we're dealing with a young baby, parents have questions. Me as the pediatrician, I have questions. Seeing the patient for 7 minutes, or kind of, if say I have to provide the time, I will provide the time. But if I know I have a full waiting room, people are waiting 45 minutes, an hour, 2 hours, 3 hours, and have patients in the other rooms, it puts too much stress, and so I'm forced to rush.
How do you afford to do this stuff? I mean, tell us first about the pay structure. How do you get reimbursed?
So I get reimbursed by the parents, by the patient. My boss is the patient. I'm not working for an insurance company, so I'm not running around trying to bill and code and then fighting with an insurance to get paid. I'm getting paid directly by the parent. So with Rivertown's Pediatrics, it's a membership-based model. So it's starting at $100 a month, and that provides extended time. I'm not rushed. I can schedule my patients accordingly with the access, same-day appointments if needed. And because of that, because I'm being paid by the patient and their family, I don't have the overhead costs that's associated with insurance. So I don't need to I don't need to limit my office hours between 9 and 5 and try to pack in as many patients. I don't need to hire staff, which currently with traditional kind of insurance model, I would have to have a receptionist to check in the patient, verify the insurance.
Somebody to do the back office work.
And then a medical assistant to do the back office work. May need an office manager who does the billing, to fight with the insurance company to get reimbursed or to get the patient visit covered. I don't need to have any of that.
So how much would it cost you if you were doing it that way with a receptionist and the medical assistant and all that? What would your overhead be?
Overhead. One estimate, when I was sitting down and talking to a larger hospital group that was going to buy me out, the overhead would have been $350,000 because of the additional costs of staff, of the kind of the fancy electronic medical record system.
Right.
You know, when you have an overhead that high, what are you forced to do? See more patients.
Right.
And so it becomes a factory.
Yeah.
So
instead, your overhead is roughly what now?
it's about $50,000.
$50,000.
It's my rent.
Yeah.
It's my rent with my malpractice insurance and the cost of my equipment. But it's a $300,000 difference.
Yeah.
And so by saving that much money, I can spend more time with the patient. I don't need to see thousands of patients.
Right.
I'm limiting myself to 400 patients. And why 400? I just threw that out there.
Well,
Seemed like a good idea.
it raises an interesting question, though. I mean, you are available to your patients now just about any time they want it. You have 24/7,
Mhm.
right? At what point in accumulating patients does that come under pressure, where you're not going to be available because you're over doing a house call here when you're called for another one?
Yes.
there?
So if, say, we have a bad flu season like last year, then I'm not going to necessarily be doing the 1-hour house calls unless needed. But my patients that I do have now, they're all very understanding.
Mhm.
They'll understand. And now if I do schedule an appointment, if we have a scheduled appointment in my office, you have a 2 o'clock appointment, you're seen at 2. You're not going to sit there in my waiting room until 3. No, you're seen at 2. If it's house calls, it might just be easier if say I've got 15 phone calls that day. Maybe I'll say, hey, you know what? Let's just schedule those in the office.
It seems to me that every mom in town, knowing that you do house calls, is going to want you to do a house call. How do you differentiate between the ones that you really need to go there as opposed to ones where they could come in?
So the house calls are fairly limited to the river towns.
Right.
I say fairly.
You're not going to go to Albany or something.
I'm not going to Albany. I'm not going to Poughkeepsie. I am kind of venturing out to White Plains and Greenberg. So, and that's okay. It's got to be about a 15-minute radius around my office.
Right. I just should interject here that you're based in Dobbs Ferry,
Based in
and
Dobbs
your
Ferry.
office is in Dobbs Ferry, so that's ground zero.
That's ground. Yes, correct. So that'll take me out to White Plains, Bronxville, things like that, Mount Vernon, and so it's actually interesting because some parents just prefer to bring their kid to my office. They just like it that way, and actually some of the kids, they actually rather just come to the office because I actually know every kid's favorite TV show. That's part of the interview process.
Wow.
Yeah, what's your favorite TV show? So I have one kid who likes Team Umizoomi. So when she's scheduled, I have Team Umizoomi on. Have you ever watched that program?
No.
Yeah, it's pretty fun. But I have it on the TV, and she comes in. She comes to my house. She thinks that's my house, Dr. Gupta's house. Goes and grabs a juice box out of the fridge and just relaxes and watches her show. I don't think she actually realizes I'm her pediatrician. She actually has a lot of fun.
A family friend?
The
guy who turns the TV
She just
set
hangs.
on.
She comes over, and every time if she's scheduled, it's always an hour-long visit because she's just hanging out. And you know what? That's fine. I've given her a flu shot. She hated me for about all of 30 seconds, and then went back to sipping away, eating her snacks, watching her show. But it's a comfortable environment. And so, not everybody likes the house call. They actually like to come there, and that's okay.
Have you ever had more than one patient in your office at a time?
I try not to.
Yeah.
I try not to because I don't want the germs. I don't want to. If they're coming in for a sick visit, I really don't want to. I don't want them kind of spreading germs to the others. I do have siblings, and they come together. But I try not to have any overlap, because what that means is that might mean wait for the person who's coming, and I really don't like having parents wait or patients wait.
And parents don't like to wait
No.
either, nor do they like to put their kids into a crowded room where a bunch of kids are sniffling.
Exactly. I mean, we're just so busy as a society. I mean, we all have things to do. I think it's disrespectful to have people wait that long, an hour, even 15 minutes.
Mm-hmm.
No, you have an appointment. You got to be seen when you're scheduled. And so when I was picking out my office, one big concern I had was the parking. It's not great parking where I am. But what I did realize is like, wait. I actually don't need to worry about the parking, because I'll probably do a house call, or I have one patient at a time. So there's always one spot available.
You're available 24/7.
Yes.
What happens? I mean, that means you're going all the time. Do you ever have a time to go on vacation, or what happens if you get sick? Do you have a backup? How does that work?
So I do have a backup, and it is a scheduled. When I do go on vacation, it's not going to be in the middle of flu season. It's gonna be kind of typically when we have a down period. So I will be planning on a vacation in April. Right. Typically that's a pretty slow period, and I do have a backup who will come in and see the patients if they need to. But a lot of times with the technology that we have now, and that's the thing, I don't know why other doctors aren't using it.
You can Skype
we
on your
have our
vacation.
cell phones.
Yeah.
Yeah, I do have a secure system for texting and a video chat.
Right.
I don't know why we're not using it. Oh, actually, I do know why. Insurance doesn't really cover it. So
if you do a diagnosis over Skype, it doesn't count? I mean, with the insurance company?
they're not paying for the Skype.
You're right. Yeah.
And that's what's happened. We for physicians, it's become a job now. Yeah. And I didn't go into medicine for a job. This is who I am as a pediatrician. So I'm not that comfortable being contained between 9 and 5.
Yeah.
So that's why my patients have access to me. So I don't care about what the insurance reimburses or not, because I'm not working for them anymore. I'm working for you. And so, do I need that vacation in April? Probably not. Yeah. I'm doing what I like. Also, since I'm not seeing thousands of patients like I used to, I'm seeing only a few hundred. Right. Will I actually need that vacation? I'm not burnt out.
Yeah. Tell us a little bit of the backstory of how you got into this. What was it that led you to this practice, other than the economics of it?
Okay, so over the years, with the reducing reimbursements, we've been forced to see more. A busy physician is a successful physician. I got to the point where I was seeing 35 to 40 patients a day. And financially that looked great. But was I providing a good enough service? I wasn't. I wasn't doing what I needed to do for my patients. If I had to keep running to the next patient. By the end of the day, after seeing 40 patients, I was burnt out. So if somebody called at 8 o'clock at night, I just didn't have it in me to even be friendly on the phone. So
I've noticed that about doctors. They're not very friendly at 8 o'clock at night.
No. Well, because we're facing burnout now.
Right. Yeah.
And burnout, physician suicides at an all-time high now. Because we've turned it into a factory. Right. And also over the last 2 years, what I really noticed was our deductibles have been going up. Right. So when a parent brings their child in for a fever, sometimes the first day of a fever, it's tough to know what's the cause of it. Most likely it's a viral infection, a cold or something. So the standard is saying, okay, they've got a cold, we're going to do supportive care, Tylenol, Motrin, lots of fluids. But if anything changes, please come back. So turns out maybe that cough was getting worse. That cough was leading to a little bit of difficulty breathing. And say there's a pneumonia kind of hiding under there, which wasn't apparent when we saw them at 12 in the afternoon, but maybe later that night it got worse. Well, with those higher deductibles, well, we just saw that patient that day. The parent may not be able to afford seeing that, to bring the kid in the next day or that night, because that's another office visit. If you haven't reached your deductible, you're paying a full price. Say it's a $250 office visit. If it's after hours, throw on another $100 for the after hours fee. So I want to take that away. So just before coming here, I had a house call. And what I always tell the parents, I always tell them that the office visit doesn't end the minute I leave the house. Because there may be something more later tonight. So don't hesitate to call. I have no problem seeing a child 3 times in one day. Now, if I were to take insurance, I'd have to bill them 3 times. But since they're paying a flat monthly fee, I see them, and there's no hesitation. And I want the parents to feel comfortable that their kid has care. And say it's late at night, if the kid turns out the kid needs an antibiotic or needs a dose of steroids, I keep that in my medical bag. So if there's medication, or say the child's wheezing, is having an asthma attack, I have medication. I can bring it. I can start the child on their medication, and then send the rest of the script in the morning for them to fill. But I can at least get them started.
Most of your previous practice was in the New York area in one
Yes.
form or another, with one exception. I believe you were in Caribou, Maine for a while.
Caribou, Maine.
Tell us about what that experience was like and what role it played in your doing the concierge route that you were taking.
Yes. Caribou, that was a great time. So actually, like I said in the beginning, I was doing a fellowship in gastroenterology. So I didn't complete it. So that's why I'm not certified.
I see.
But I did 2 years. During that time, my father was very ill, and it was difficult. Also, what I realized was I wasn't a specialist. I couldn't just be confined to just the stomach. I really like to
The whole person.
The whole person. So I didn't want to be confined to not treating that kid's ear infection, and I had to focus on that gut. It was a very difficult 2 years during that fellowship with my dad passing away, dying. I was starting to burn out. Emotionally, I couldn't be there for my father.
Who was in California?
In California. And so I actually, at that point, I was actually about to quit medicine altogether. But I had a few patients who threatened to kill me. Well, their mothers threatened to kill me if I left medicine. So when I came back to New York after taking care of after my dad's funeral, when taking care of the kind of family business, it was tough, and so I realized I just need to get out. So I need to just go away for a little bit, and so I figured Caribou, Maine.
A logical choice.
Yeah, I tried to go the farthest place I could. I really did. You know what? I had to run away. And so I chose to go to Caribou, Maine, in the dead of winter, from January to March, and that actually, I was on the verge of just leaving medicine altogether.
Yeah. But you practiced up there?
I practiced up there. Figured, let me just give it a go. Let me see. Let me just hit the reset button. And I was welcomed by a very loving community. Just welcomed me in. And what I loved about that community was that everybody, they went out of their way to help each other. And same went for patient care. There was no talk about, does the patient have insurance or not. It was the patient needed to be seen, and provided medical care. And my nurse, her name was Sandy, she knew everybody in town. So she always gave me a little background history about everybody. And so I kind of went in already prepared, knowing about that patient, tried to talk about the needs of that patient, if they needed anything financially, nutritionally, anything I needed to, if I needed to get them support from the WIC program, things like that. And it was that need, it was that community feel, what everybody did for each other. I was always on call for deliveries. If there was a C-section, a pediatrician, I'd be there. And there were stories of a stat C-section. Where do we get but where's the obstetrician? Somebody from the hospital would actually go on their snowmobile, picked up the obstetrician, brought him in on the snow sled. But that's what people did. Then I came back to New York. We didn't do that. It's like your patient at 8 o'clock needs to see a doctor. Over there, okay, you know what? Let me just see you in the emergency room. Not here. It's different. All right, I just had a long shift. You know what? Just go to the emergency room or an urgent care. And that fragments. That actually leads to a fragmented care. It's really important to see this your physician frequently for an illness, consistency, because that child's illness may have evolved, may have changed. So I figured, yeah, it's just time for me to just kind of change it. Kind of take the principles I learned of the community field in Caribou and apply it to my community, in Dobbs and the river towns.
And that led to the concierge practice.
Yeah, what we call concierge.
Yeah, I don't know what else to call it.
I know.
Is there an official name for it? Or?
What I like to say is, it's what we used to do. When you were a kid, when I was a young kid, that's how medicine was, and it's how medicine is still practiced in other parts. Right? I think you had an experience in
I did in Germany with one of our children who was quite ill, and I was just astonished when the doctor came to our house at 7:30 at night and treated her there. It was such a complete departure from anything that we were used to in this country. But if I'm a parent of a child and I've got a family, so I'm going to have medical insurance for the family, I'm going to pay for that anyway, right? So why do I want to, in addition to that, pay you $100 or $150 for an infant a month to above and beyond that insurance? What's the rationale there, and what do you tell patients or families who are concerned about that?
There are two things. It's convenience, and also I might help you save money. The convenience part, you have me 24/7. Right. And you have access to a same-day appointment if you need it, or you have access to it. So the convenience is there, especially if in busy households. My wife doesn't get home till 7. There's no way that she would ever be able to make it to a doctor's appointment. So a lot of parents can't take half a day off. For the doctor's appointment. Now, when it comes to saving money, with deductibles going up, sometimes if we pay more in a premium, we may have a low deductible, low copay. Great, but then you might be paying $24,000 in premiums a year. Now that's expensive. On the other end, you get if you have insurance that you can afford, but then you find you have a $5,000 or $10,000 deductible. Well, now you have insurance, but you can't afford to get sick. Say if you have a 5-year-old child, 5 and up, it's $100 a month. Well, that's $1,200 a year. That's still a lot less than that $5,000 deductible. Plus, you have a consistent care with me, and you don't have to worry about affording that copay, affording that deductible. You have the comfort of knowing that I'm there, and I think that's what a lot of families need.
Yeah. At some point, if a kid is really sick and needs to have a specialist,
Yep.
see a specialist or be hospitalized, you do the handover much
Yes.
the way any other doctor, is that
Yes.
right?
That's correct. So I did have a patient recently that I saw that patient multiple times during the day, and by the evening I saw that he was getting a little sicker, and difficulty breathing. Could do what I did what I could do, but he needed to be in the hospital. So I called over my colleagues over at the hospital, notified that he was coming, and the parents said, no, you don't have to come. And so, of course, I went home, and then I just had to go. I ended up going to the ER because so I could be there to let the ER physician know how he worsened throughout the day. And then I was there every day to help with the information, also help kind of tell the team, the hospital team, kind of the background history on the patient and the follow-up. So I handed him off, and then also I was there for when they handed him back to me.
Right.
So, but that can happen. Nowadays, though, we as pediatricians, we're doing a pretty good job of keeping the kids out of the hospital, and so it's pretty rare for a kid to be hospitalized. Now, if they need a specialist, certain things, non-urgent specialist visits may not necessarily be needed. Say with a child who has chronic constipation or asthma. Well, I have the time to dedicate to that patient, so I can work out a plan to step up, say, the medications for that asthmatic or for the patient with constipation. So there may not necessarily be that need. Now, if they need specialized testing, that's a different story. But again, the handoff is there, in that communication between the doctors will be there. Because I have the time. I have more than 7 minutes.
You don't take insurance, but you're not immune from is the insurance
Yes, so I don't think anybody's but that's actually very interesting. My malpractice is about a quarter of what it used to be, and I was shocked by that. So I asked them. I asked the broker. I said, "What is this?" He said, "Oh yeah, concierge docs don't get sued as much."
So you have lower.
That's about a quarter of the cost.
That's amazing.
Because we spend more time with patients, and so our likelihood of misdiagnosis or maltreatment is lower.
Mm-hmm.
So.
Dr. Gupta, I would expect that people who are watching this show, especially parents, and they heard the phrase house calls, are going to want to know how to find you. So how do they find you?
Okay, so you'll find me, you can go to rivertownspeds.com, or you can always call my office at 914-330-8445, or send me an email at info@rivertownspeds.com.
Thank you very much. Appreciate you coming.
Thank you.